Children and sealants, Dr. Vuong, sealants on teeth. In fact, maybe even sealants on adults. Shed some light on the whole story of sealants, how good they are, what are they for, why are they there, and who should get them?
Sealants are a great preventative measure for teeth that just erupt. Once they just erupt, that's the perfect time to be placing a sealant, which is a protective layer that goes over the deep grooves of our back teeth, mainly the molars and premolars, to help prevent cavities from growing inside those grooves.
Okay.
Yeah, and people, the person who benefit the most from sealants are kids. Adults can benefit from them too, but the best time to put the sealant on is when the tooth just erupts.
Because of why?
Of why? Well, when the tooth just erupts, there's no bacteria in those grooves, and it's the perfect time to seal them up to prevent cavities from getting into the grooves.
I see. So otherwise you can possibly enclose a bacteria in the filling, and then it keeps growing there, even though you have a sealant on it, because it's already in it.
It's already in there. That's right.
I got it. Okay. Is it true that some people, children, people, period, they have teeth, molars, as you mentioned, the big ones in the back with a big flat surface? Well, it's not really so flat, but that some people have bigger grooves than others, just like a rock. Some rocks are smoother than others, and the ones who have, for some reason, bigger grooves, they need to have the sealants so much the more, because those grooves are on one hand pretty big, but on the other hand so small that no toothbrush will ever go into it. Is that true?
That's true. The grooves of our back molars, they are very small. Once bacteria get in there, no matter how well you brush, you're still going to get a cavity once bacteria get in there. So the perfect and the most easiest way to prevent cavities is to get a sealant. Not everybody needs them, just the people that have these teeth that have very deep grooves on their molars. But the majority of people do have these deep grooves. Some people have very flat teeth, but it's not too often that we see that.
Got it. All right. And how long does such a sealant last, more or less, give or take?
Sealants last quite a while. I would say sealants can last anywhere from 3 years to 5 years. I've even seen them last 10 years. It all depends on how well they're placed and how well the patient takes care of them.
How does he take well or not well care of?
Well, taking good care of it is just brushing and flossing every day, rinsing your mouth after you drink any kind of sweet beverage, brushing right away after you eat candy. That's taking good care of the teeth.
Got it. Does eating habits such as chewing a lot on nuts or certain things have an impact also?
Sure. Of course, when you're eating hard foods or sticky foods, of course that puts a little bit more force on the restorations or slash sealants, and it just puts a little bit more mileage on our teeth in general. Anytime we use them, of course, they wear down a little bit.
Got it. And on an average, once they have been worn off, 3 to 5 to 8 years, whatever, should the person then replace them again?
Yes, definitely. That's why it's really important to go to the dentist routinely, because for all the patients that come to our office every 6 months, we check their teeth, we take a look at all the sealants, make sure that they're still on there, and if they're not, we replace them.
Got it. Thank you very much, Dr. Vuong.